My name is Murray Bennett. I'm a postdoc at the University of Texas at San Antonio, where I've been working with Joe Haupt on a project looking at human perception of the features of skin lesions that are used for melanoma identification in comparison to computer vision algorithms and neural networks. Today, I'll be sharing results from part of this project where we took a general recognition theory approach to try and understand if and how people integrate information across these perceptual features, particularly shape asymmetry, border irregularity, and color variance. Towards the end of the presentation, I'll pivot slightly to demonstrate our approach to extracting and evaluating the features used by a deep convolutional neural network and how we might be able to use these features and information representations in our aims for future work. Now, melanoma only makes up about 10% of all skin cancers, but due to its rapid growth, melanoma is actually the deadliest form of skin cancer. And it's because of this rapid growth, the earlier you can identify melanoma, the earlier you can remove it, thereby increasing survival rates. Now, the primary method for melanoma detection is via a self-skin examination, where you'll conduct a visual scan of your skin lesions for signs of melanoma. However, it's not always clear, particularly to novice observers such as you or I, as to what signals melanoma. Now, take these images, for example. Which of these lesions would you diagnose as melanoma? Now, in fact, it's all images on the right here, but it's quite difficult to differentiate any distinct features that would help drive this decision. Signs do exist, though, but due to this perceptual difficulty, some rules-based heuristics have been generated to help aid novice observers when making these decisions. A common and well-known guide is the ABC method, where we're prompted to check distinct perceptual features of the skin lesions that can serve as indicators for this abnormal growth. And these are shape asymmetry, border irregularity, and color variation. If a lesion is judged to be abnormal along one of these dimensions, then we should go and seek expert evaluation. So we should go see a dermatologist. Now, with these rules in mind, I challenge you again. Let's try and evaluate some skin lesions based on, in particular, just their shape symmetry. So at which point along this dimension of shape symmetry would you draw your line for something being, for one of these skin lesions being sufficiently atypical in that asymmetry? At which point would you decide this is suspicious, I should go and get it checked out? Now, this is clearly a subjective decision, so there'll be personal bias in where you draw that line, but perhaps another aspect has come through for you in this exercise in that these features don't just occur in isolation. There are varying degrees of border irregularity and color variance across all of these images. So are you making your decision based entirely on symmetry alone when you're asked to evaluate symmetry, or does this presence of other atypical features influence your judgment? And how might this affect our ability to accurately identify melanoma? So the aim of this project was to examine if and how people combine perceptual information when they're evaluating these skin lesions. Now, this is the type of question. So this type of question, does perception of one feature depend upon perception of another, is precisely the type of question addressed through the General Recognition Framework, or GRT. GRT is often regarded as or considered like a multi-dimensional version of signal detection theory, as it's defined by a two-stage model of encoding and response. And we'll go through this encoding process now. So it assumes that each time where we see a stimulus, a single stimulus, our perception of this stimulus our perception of the stimulus features, in this case, shape symmetry, it'll vary. So we'll never see the same stimulus exactly the same way each time. And we can represent this perceptual variance probabilistically via some distribution. However, stimuli are rarely made up of individual features. We're also perceiving other features at the same time, such as border regularity. And this will also have some perceptual distribution. So now we're estimating some joint perceptual distribution of these features. And that's the target of a GRT analysis. So here, this ellipse represents the joint distribution of these features, and the cross in the center represents the mean of that distribution. Now, so far, all of this has just been for a single level of feature strength. So border regularity and shape symmetry when it's all at the same degree. To evaluate how perceptual information relates between or across features, we need to examine perception of these features across multiple levels. So the standard GRT assessment uses a double factorial design where we have two levels, a low and a high of one perceptual feature, such as, again, shape symmetry, together with the factorial combination of two levels from another dimension, like border regularity. So this now gives us 4 categories of skin lesions for a participant to identify, so that instead of a single perceptual distribution, we would now have 4 distributions, one for each of these categories. And we model these distributions using participants' confusions between those categories. Now, this example model output that I have here is similar to what you would is similar to what we'll examine in our results shortly. But this particular output demonstrates what we would expect to see if there was perceptual independence, if there was perceptual separation between the dimensions. That is, that my perception of shape symmetry has no effect or doesn't interact with my perception of border regularity. Now, the key indicators, we can evaluate that visually, right, with this type of this model output. Now, the key indicators here are the vertical and horizontal alignment of the crosses of the means of the distributions, and the circular shape of the distribution as well. So if there's dependence between perceptual dimensions, if there's an interaction, then these distributions will take on a more elliptical shape. Such a shape would represent correlation between features, so that we can say that our perceptual judgments of one feature is influenced by the perception of the other. All of which you'll see in a minute. So the experiment that we ran used a pool of images drawn from the ICCM archive. It's an online repository of skin lesion images. On each trial, participants were shown 2 images. One was a reference image that was neutral on both perceptual dimensions, so it was so that you would have high or low, but the reference image was roughly in between those high and low dimensions. And the other image was a target, which showed an image from one of those 4 categories. So participants used a keyboard to indicate which category they thought the target belonged to, which roughly corresponded to the position of each of those categories I showed you before. Participants were given a block of instructional trials to start with to familiarize themselves with the task, and the keyboard responses, a further 40 practice trials with feedback, then a brief staircase procedure to determine the set of images used for the category feature levels. This was then followed by 5 blocks of experimental trials. Now, we ran the experiment across 3 between subject conditions, where each condition presented participants with a different set of features. So the first was symmetry and border regularity and color uniformity, and another, and finally, symmetry and color uniformity. So we collected data from a total of 71 participants, and following data cleaning, we were left with roughly 20 participants per condition, to which we then applied our GRT model analysis of these data. So here we have our model estimates for 3 individuals from each of those 3 conditions. They in no way at all look like the example model that I showed earlier. Keep in mind here, the model is fit per participant, and there's variation naturally across participants, but I present just these 3 data from these 3 participants to demonstrate what we saw to be the overall trend. We can see that for each condition, distribution means are not aligned. Our distribution shapes are all elliptical. It's not that nice circular shape, indicating dependence and an inability to separate perceptual information across these dimensions. So in more practical terms, using this left figure as an example, this output indicates that we might judge a lesion as being more asymmetrical when border irregularity is also high, and vice versa. And that pattern is present for each of those perceptual dimensions. In fact, if we were to draw a line along the diagonal, it appears that rather than having like multiple distinct dimensions, representations of these features essentially collapses along a single dimension here, and what we're calling like an overall ugliness dimension. And this is interesting. So prior research on judgments of skin lesions indicate that experts evaluate skin lesions holistically, that they collapse information across features. And novice observers utilize distinct features. Now, our data indicates that our novice participants are combining information, but I don't think that this is necessarily a conflicting finding. I think it adds to it. Our results suggest here that although we look for specific features, perhaps when evaluating skin lesions, we're actually just poor at evaluating these features independently. And perhaps our amateur identification abilities actually just comes from an inability to effectively separate this information when we're evaluating it, which is potentially a negative, but the positive, I think, here is that it makes this a potential target for training perceptual expertise. And that's the future direction that we would like to go in here, is to attempt to train novices to start to use this perceptual information a bit more effectively. So in some proposed design here, one approach might be to train participant sensitivity along each of these ABC dimensions. For example, we have measures of shape asymmetry. We can pick images from the extremes at the early stages of training and gradually reduce this difference as participants improve. You would test their identification accuracy at regular intervals, and you could utilize this GRT approach to examine if and how their feature representations change with training, and if they approach something that represents that of perhaps an experienced dermatologist. Now, at this point in the talk, this is where I'll pivot slightly. Experienced dermatologists are certainly the gold standard for perceptual expertise and performance in melanoma identification, but another source of high-level performance comes in the form of deep convolutional neural networks. And if we can build the way neural networks represent information into such a training paradigm, then perhaps we can make meaningful headway in training people for accurate melanoma identification. So deep neural networks, or deep convolutional neural networks, are excellent image processors. They've excelled in this domain for a number of years. Now, such networks take in an image, they pass it through a series of convolutional layers where features such as shape and edges are detected. These features are then processed, they're pooled, they're passed through a neural network that then learns what features are important for classification. And in this case, that's melanoma identification. The key here for our approach is that in this final activation layer that I've highlighted, right before that classification decision, the weights contained in each of these neurons represent the value of the features the network has used to make this classification. In the model that we've trained, there are some 1,280 neurons here, which is far too many to train a person on. Instead, we utilize dimensionality reduction techniques, in this case, singular value decomposition, which is the basis for like principal component analysis, to collapse these dimensions along, or collapse them into two dimensions. And we have here some preliminary, you'd say, exploratory results here. I'm intentionally hand wavy because we're at a very hand wavy part of the project. Here I have for you 6 images. So we've taken this approach. I have 6 images here for you that have been sampled from those feature representation dimensions, sampled from across their range. And they follow from about the 0, 20th, 40, 60, 80, and 100th percentile. Lesions are increasing along their dimensions from left to right. At this point, it becomes an exercise in deciding what these dimensions actually are. In this case, it's not particularly clear what we're working with, but myself having the benefit of seeing a few more than just 6 images on the screen, we've tentatively labeled this first dimension as something like distinctiveness from the background, where lesions to the right are more readily defined or separated from the surrounding skin. And the second dimension being one related to texture, where images to the right, again, contain information such as hair and like wrinkly or aged skin. And this indicates that this is what the neural network is using to identify melanoma. Now, there are certainly limitations with this network, and there are optimizations that can be made in the model, in the processing pipeline, that could be beneficial to generating clearer dimensions here. But I think using this approach, the question we can now work forwards with is, can people learn to use these neural network dimensions in a meaningful and effective way that can help them identify melanoma? And the training paradigm I introduced earlier could be an effective approach to evaluating the efficacy of using neural network representations in contrast to those distinct perceptual features that we're typically trained on. And that will hopefully be the topic that I present to you in our 2025 MathPsych talk. So stop by then for those results. Thank you for your attention. Thank you for your time, and particularly thanks to Joe and the lab at UTSA. I look forward to discussing the work with you all shortly.